We begin our team coverage with Fox 9's Paul Blume tonight. Paul, you spent the day talking with those who knew and worked with George Floyd.
And Randy, there is a ton of heartbreak in this community, also in his hometown of Houston, Texas. But I got to set the scene right here at 38th in Chicago. I think you've seen it from above, from the chopper. But look at the throngs and throngs of people. This is several blocks deep. And you know what? Most of this group has already left to march through the streets of South Minneapolis. This crowd will clog up a huge portion of South Minneapolis. They are technically on the move. You've got blocks and blocks of people. Tonight, 4 police officers are fired. The FBI looking at into whether or not this was a federal civil rights violation. And back out here live, again, this crowd marching through the streets of South Minneapolis. It will take them a long time. We don't know exactly where they were going. They had just called this rally, and literally, it feels like half of Minneapolis is here tonight, angered, outraged, demanding criminal charges. Hennepin County Attorney's Office says they will be looking at this once it's all said and done. Obviously, the investigations are ongoing. Now, the medical examiner just released an initial report saying further testing is needed to determine an exact cause of death. But worth noting, last night, this 911 call for forgery came in at about 8:02. The time of death listed for George Floyd is about 9:25, an hour and a half later, over at HCMC. We're live in Minneapolis tonight. Paul Blume, Fox 9. Breaking news right here, Kelsey, right now. Take a look at the police force that has just arrived. This was not a big group of demonstrators that had remained from the George Floyd protest, but 10 o'clock struck just minutes ago, and they descended. That small old van is a medic van, quote-unquote medic van, that has supplied food and drink to the demonstrators all day on this hot June day.
You just have to wonder if what happened just about an hour or two ago here is really fanning the flames of determination for some of these folks.
Sure. Yeah, I'll try to nail down that type of feeling, but certainly if you were with us a couple minutes ago, I interviewed a community activist now running for state office, John Thompson, who they feel like this was a terrorist attack that occurred to a peaceful demonstration, proving a point, trying to have their message heard loud and clear just an hour or two ago. And the one thing that I had heard earlier is they were really frustrated and angry about police response to that scene. They really felt they were treated like the criminals, that they had done something, horribly wrong. And they did, 2 squads did pull in. They lit us up with their spotlight, wanting to know. We yelled up, media, and they were like, oh, okay, thanks, and let us on our way. So we do get some freedom with that ability to tell these stories, and authorities are allowing us to tell these stories and show what's happening in our community. Amy, Kelsey, from the outside doesn't look too bad. Some plywood boards are up here on the house, some plastic sheeting. But let me show you what happens. Inside, it is a mess. This suspected teen carjacker hitting the embankment, flying right up there, smashing into the Gordons' home. Let's give you a little perspective on the scene and specifically the distances along North Shore Drive. First, you can see the memorial to the 2 young lives lost. We'll track the Bentley as it leaves the roadway. Investigative markings. Remember, it is dark Saturday night. The crash happening around 11:30 at night. The vehicle slamming into a grove of trees. James Blue behind the wheel, according to authorities. He's unbelted and is ejected out of his high-end vehicle. We continue on our Fox 9 drone flight 3-4 driveways away. This is Blue's home.
We want to check in now with our Paul Blume, who has also been following this trial since day one. Paul, first I want to ask you, we all sort of heard the news scrambled in here breathlessly. What's your reaction to such a quick turnaround?
Yeah, it was fast. My just gut feeling is a verdict that comes back that quickly on such an intense case with the amount of evidence, the amount of witnesses. Clearly, this jury knows the world is watching. I think it is a good omen for the state, if you will. It's just my gut instinct on the amount of hours this jury put in. I mean, clearly, they got this case at 4 o'clock yesterday afternoon. They wanted to deliberate a little later than I think we expected, into the 8 o'clock hours. They spent 4 hours on it yesterday, and then turned around 12 hours later, right back at it at 8 a.m., And then this jury, this verdict announced about 10 minutes ago now. We got some early indication from our sourcing that they had started evacuating and closing down government buildings around Minneapolis, downtown, evacuating workers that had been working inside. We had understood that was going to be a precursor to a verdict announcement for safety reasons. So we got word of that, and then sources confirming, then clearly now the court is on record. Verdict has been reached. It is expected to be read in court within the hour, possibly by 3:30, 4 o'clock. That will obviously be on our live stream. We will have cameras inside for that verdict. Now, we will not see the jury itself, but the jury foreperson either will read the verdict or hand the forms to Judge Cahill, who will read the verdict, and Derek Chauvin's fate will be known at that point. Of course, the global world, entire world watching now. I'm trying to do the quick math in my head. 4 hours yesterday, 6 hours today. So we're in that 10-hour, right, 10 to 11-hour range, which, if you remember, Muhammad Noor, different case, not obviously nearly as much video evidence. I mean, there was no evidence video-wise of the actual shooting, but several years ago, the deadly police shooting, July 2017, with Justine Ruzcek-Damon, Muhammad Noor, that jury deliberated right in that 10 to 11-hour range. So just something to take note of. Certainly very different cases, very different stakes, but just something I was noting around this time frame. Yanez, the Geronimo Yanez Philando Castile deadly police shooting years earlier, that jury, you may remember, had one deadlocked juror that couldn't be convinced to go with the jury. They stretched out deliberations for 27 hours. So they really needed some time to come back with an acquittal in that case. So again, as you try to read the tea leaves in terms of how long a jury spends deliberating, I would just put that on record, between 10 plus hours from this jury, obviously committed to getting the job done quickly. During COVID, of course, sequestration, they spent last night in a hotel. My thought had been whatever decision might come today, they may take an extra night just to sleep on and might not get a verdict read until tomorrow. But clearly they're moving ahead. The court was concerned about a late day verdict. If a verdict came in, in the early evening, nighttime hours, they were going to wait for that reading for the following day. Because of fear of civil unrest developing overnight in the darkness. They wanted to give security troops and law enforcement and military the best opportunity to be in position to handle any fallout from the verdict. But clearly here they feel comfortable, middle of the afternoon. They will read this verdict, guys, in literally 60 minutes to the next 90 minutes. And we'll, of course, be here throughout.
As Minnesota passes 4,000 COVID deaths, we are taking you inside a local intensive care unit. For months, ICUs have been places of darkness, despair, and exhaustion for frontline healthcare workers. But as Paul Blume tells us, with improved treatment plans and a vaccine on the way tonight, they are also becoming a place of hope.
Our main goal is keep these people alive, and that's where we're at.
It was our first visit inside a metro area COVID intensive care unit.
Yep.
Hectic?
Hectic, chaotic. You have to create order out of chaos.
Is that what it feels like every shift?
Yes, absolutely.
The first thing you notice, it is loud. The air ventilation systems are always churning. The machines always beeping.
You close your eyes and it's in your ears. I have the rest of the stuff.
The patients, hooked up to breathing tubes and cocktails of medicine drips and steroids, keep coming, shift after shift.
These people are dying alone.
Before COVID, you'd see family and loved ones in these rooms, providing love and comfort, but not now.
It's very hard, and it's our reality right now. Like, we are holding people's hands on their last breaths every day.
Here at Methodist Hospital in St. Louis Park, they're operating 35 ICU beds. At least half of those are currently COVID patients. Dr. Nima Desai, the chief medical officer, gave us a tour.
What we really want to show is that this is real. This is something that we've been living every single day since the pandemic started.
Dr. Desai reports Methodist currently remains just short of capacity, leaving space for patients of all ailments and illness.
We've been at surge levels since April. Initial surge, we called patients, we had between 40 to 60 patients of COVID a day. Now we're seeing in the realms of 80 to 90 per day.
Minnesota health experts have predicted rising case counts, especially coming out of the Thanksgiving holiday, with frontline staff reporting the ages of those showing up in the unit that is the absolute last hope, getting younger and younger.
No one is exempt. I'll give you an example of an 18-year-old gentleman who was healthy as a horse, as for lack of a better way to put it. 18 years old, played football, defensive lineman, intubated and sedated.
In this ICU?
Yes.
Meantime, a reason to smile on Monday. A patient who came in extremely sick, barely able to walk, now going home. We found her 2 floors up, getting her treatment on what is typically the pediatric unit.
I was pretty low when I came in on that Thursday night, and the oxygen was really low.
I spoke to Virginia Farquhar through this window. She is a kidney transplant survivor who will need to continue to isolate after her hospital discharge.
I'm not out of the woods. I'm still positive. I am on my own oxygen now. I'm not dependent on oxygen support.
Virginia was so grateful for the care she received at Methodist, where doctors, nurses, and staff are improving outcomes each and every day, often cutting down on required hospital time as they learn more about the novel coronavirus. But their plea remains. They need help during the holidays and are begging people to follow public health guidance in wearing masks, washing hands, and keeping distance from others as they wait for the vaccine.
You do not want to end up here. We're good at what we do. However, prevention is the best medicine.
Where is this light at the end of the tunnel? I'd like to see it. I'm hoping this vaccine, but I mean, we just keep going day to day, and this is our norm.
At Methodist Hospital, Paul Blume, Fox 9.
What a great look.
Powerful piece
Yeah.
there, and to think about having to work long hours in the ICU at this time.
They talk about the light at the end of the tunnel, and clearly there is at some point, but the governor reminded us again today that we still have not hit the worst part of what Minnesota is likely to see because of the infection rates that are happening, the hospitalizations that we're seeing in Paul's piece. They keep building.